Hey everyone, we're going to talk about something really important today, a virus that's a leading cause of birth defects. But somehow, most expectant parents have never even heard its name. It's time we change that.
So let me ask you, when you think about infections you've got to watch out for during pregnancy, what pops into your head? Probably Zika, right? With all those scary headlines a few years back. Or maybe rubella. That's a classic one. And yeah, those are definitely on the list. But the number one most common viral infection passed from mom to baby, well, it's one you almost never hear about. And honestly, that silence, that lack of awareness, that's exactly why we need to talk about this. It's so important.
All right, so let's get into it. Let's pull back the curtain on what I like to call the most common unknown virus out there. Okay, the name is Cytomegalovirus, which is a mouthful, so everyone just calls it CMV. It's actually in the herpes virus family, which might sound scary, but it's super common. And here's the kicker. It's the number one cause of congenital infections. That just means an infection a baby is born with.
So hearing that, you might be thinking, okay, how common is common? What's the real risk here? It's so easy to start worrying, I get it. But let's look at the actual numbers. We're going to break it down like a funnel, starting wide and getting narrower, to really see what this looks like for parents to be.
All right, at the very top of our funnel, the widest part, we're looking at about 1 in every 100 pregnant women. That's how many will get a new CMV infection during their pregnancy. So that's our starting point. But right away, the funnel starts to get smaller. See, just because the mom gets infected doesn't mean the baby will. Out of all those women, only about 1/3 actually pass the virus to their fetus. It's called vertical transmission. And now we get to the very bottom, the most important number in this whole equation. Out of the babies that do get infected, only about 5% will actually show any signs of damage from CMV. Now, that risk is highest if the infection happens early on in the first trimester. So you see, we start with 1 in 100, which sounds a little scary, but the actual risk of a problem for the baby is way smaller. So that begs a really big question, right? If this virus is everywhere, but nobody's heard of it, how would you even know you have it? How is it detected? Let's dig into that. And here's the tricky part, the real challenge with CMV. For most of us, if we get it, we feel nothing. It's completely asymptomatic. You'd have no idea. And if you do feel something, it's usually just like a mild flu, or maybe you feel kind of run down like you have mono. That's it. And that's exactly why it just flies under the radar for almost everyone. So let's say a doctor does suspect a CMV infection. What happens then? Well, the process is pretty straightforward. It all starts with a blood test, a serology test. This is looking for antibodies. Think of it like this. IgM antibodies are like the first responders. They show up when an infection is new and active. Then you have IgG antibodies, which are like the veterans. They stick around for the long haul to show you've had the infection in the past. This test helps figure out if the infection is recent. And if it is, that's when you get a referral to a fetal medicine specialist. And that specialist's job really is to help answer the biggest question of all. Did the virus make it to the baby? And if it did, what does that mean? This is, where things can get really serious and stressful for parents. To find out for sure if the fetus is infected, there's a procedure called an amniocentesis. That's where they take a small sample of the amniotic fluid to test it directly for the virus. But the timing on this is absolutely critical. It can't be done before 21 weeks. Why? Because that's when the baby's kidneys are finally mature enough to start peeing out the virus into the fluid. Before that, you just wouldn't be able to detect it. Okay, so if that test comes back positive, that's the start of a really personal and honestly a very difficult journey for a family. The whole focus shifts to just understanding what's happening, what the possible outcomes are, and what all the options are so you can make the right decision for you. And this is the tough reality of the situation. There's no treatment for the mother. The standard antiviral drugs aren't safe to use during pregnancy. And unfortunately, right now, there isn't an effective therapy for the fetus either. So what can you do? It really comes down to two things: monitoring very closely and making some incredibly informed and difficult choices. So for families who decide to continue with the pregnancy, the path forward is one of careful observation. This means lots of detailed ultrasounds, looking for any signs that CMV is causing problems. Now, there is some really promising research happening with things like hyperimmune globulin therapy, but it's just not standard practice yet. And we have to be upfront about this. Termination of the pregnancy is also an option, and it's something that doctors will discuss with the family.
So let's talk about what happens after birth. For babies who are born with congenital CMV, what does life look like? It's not a single answer. It's really a spectrum of different outcomes, and it's super important to understand that range.
Okay, so you have two main groups. On one hand, you have a small number of babies who show symptoms right at birth, things like being very small or having jaundice. And for this group, the health challenges can be pretty significant. But, and this is a really big but, the vast majority of babies born with CMV have no symptoms at all. They look perfectly healthy. For this much larger group, there's about a 10 to 15% chance of developing issues down the road, and the most common one by far is hearing loss. And this chart really just hammers that point home. Look at this. For all those babies born with the virus but who seem perfectly fine at birth, a full 85% of them will never develop any long-term problems from it, ever. That's a huge, powerful, and honestly a deeply reassuring number for so many families going through this. Which brings us to one last big question. I mean, if CMV is the #1 congenital viral infection, if it affects thousands of families every single year, why haven't we heard of it? Why isn't this common knowledge? It's a really interesting question, right? It points to this huge gap between what doctors know and what the public knows. And maybe just by watching this and sharing it, we can all start to close that gap. Thanks for sticking with me on this one.